I had my Skype appointment with the doctor from the stem cell clinic at Swiss Medica, and let's just get right into this. So I was a little bit confused, partly misinformed, partly confused about exactly what this treatment does or can or cannot do. So I wasn't sure if they were trying to say that this was like a cure for our disease or can put you in long-term remission, like a very long-term remission. And from the information I got from the doctor at the stem cell clinic, really what this does is put you in a long-term remission without you would hope without the need for a lot of these cytotoxic drugs. It depends. Every person is different. Some people don't respond at all to stem cells, and some people respond very well. And this is also another big question I had was, is this something that you have to repeat, right? Because it's pricey, and also if it needs to be repeated every certain amount of years to maintain this remission and not having to, well, we would hope, not having to be on all of these cytotoxic drugs, that's kind of a big deal. So depending on the person, you could have to repeat this every year, every 5 years. It depends on you and how your body responds. So I was a little bit disappointed with that. I was hoping this is something you would have to do only once, but this is something you might very well have to repeat if even it does work for you. She also explained that this is an experimental treatment. Of course, I was already aware of that. So let's get into some of the questions, the other questions that they answered for me. So I did do a good amount of research to just make sure that I knew what questions to ask. So this was a first one that to me was very important. I asked them if they expand the stem cells. It's this process where they put the cells in an incubator, sort of, and they expand them to give you a larger amount of stem cells to make them multiply in a way. I've heard from other doctors that I've been following that do stem cell research and that are currently in the field that is not a good thing for them to be tampering with them in such a way, and actually has the opposite effect. You think you're getting more cells, but can make them less effective, basically. So I wanted to just ask them and make sure that that was not the case, and they do not. This particular clinic, Swiss Medica, does not expand the stem cells. They don't alter it in any way. The other thing I had a really important question about was, how do you know that you're getting healthy stem cells? And how do you know that they are not contaminated with any kind of communicable diseases? Because, I mean, that's really serious, right? So with Swiss Medica, all the stem cells come with a passport where basically they're tested numerous times for communicable diseases before being frozen and then given directly to you. So they go through a whole vetting process. What I thought was really interesting is they don't only look for communicable diseases, they also look to make sure that there's no Epstein-Barr virus in the mother. So here's the thing. One of the things that I knew they were going to, I instinctively knew that they were going to say, and makes a lot of sense to me, they will often use they'll harvest your own cells and also use donor cells. In my particular case, they don't want to use any of my own stem cells. And that makes sense to me because obviously my own stem cells are just not doing what they need to be doing. So it made perfect sense to me, and they might be damaged in some way, who knows. So that really made sense to me a lot. They don't want to use any donor cells, they don't want to use any of my own cells. They want to use all donor cells, mesenchymal stem cells from placenta and umbilical cord. So that being said, I was very concerned about making sure that there's no communicable diseases. And they are tested. It comes with paperwork and a passport, they call it, proving basically that they have been tested numerous times. And they also only accept stem cells from mothers that are healthy, and they test the mothers for the Epstein-Barr virus. I thought that's interesting because, both myself and all the members of my family that have autoimmune disease also have a really high Epstein-Barr virus titer. So I thought that that's interesting that they are even testing the mothers, because I had no idea that that virus could be passed from mother to baby. I guess that makes sense. But the Epstein-Barr virus doesn't seem to be something that's taken very seriously in the United States. So that was really interesting. I asked them if I would have to take my immune suppressant medications to have this done. Now, they said no, they cannot, they're not going to recommend that you go off if you have autoimmune disease or whatever you have going on, that you're going to go off your medications, because they're not your specialist and they don't have the legal right to do that, and that would most likely put them in a really bad legal situation if they tried to tell you to do this. And I'm even less concerned about that because I'm going to be receiving stem cells from a donor. And so with all these immune suppressants, there's a little chance anyway that your body would reject these cells because they are mesenchymal stem cells, but there's an even smaller chance because I'm on all these immune suppressant drugs and even specifically an anti-rejection drug. So this is even kind of a good thing in a way, because my immune system's already being put down. There's a very low likelihood that I would reject these cells given that situation. So no, you don't have to stop your medication. Now, if they had to do some procedures to extract stem cells from your own body, then I don't know, that could be a different situation, because you don't want to have any kind of procedure, any serious procedure that you would have a wound from or something on immune suppressants. So I don't know what they would do in that situation. But if you're like me and your immune system is very dysfunctional, then they might not want to use your cells anyway. I asked a really important question, and I've already kind of touched on this, but how much of your disease can you expect to subside? Could I possibly get off all my lupus medications? This was one of my biggest concerns. Is this a cure, or is this just another treatment? So the answer to this question, as I kind of stated previously, the point of this is to put you in a long-term remission. And there's no telling, because this is very experimental at this stage, how long that could last, or even if it will work at all. It's a chance. They said what they do know is it's not going to make you worse. It's just, it depends on how your body responds. So I wanted to make that very clear. This doesn't work for everybody, and it just depends on your own body. And also, lifestyle choices like exercise, not smoking cigarettes, not drinking excessively, drug use, obviously, things of this nature, making sure that your body is in the best possible health that it can be in despite the disease we have, is going to help determine how well you respond to stem cell treatment. So they want you to try to be in good health, proper nutrition, exercising, not smoking cigarettes or doing things that'll affect your health in that way before treatment and after. So definitely some lifestyle changes for a lot of us before and even after, because once you're in remission, if it does work for you, you certainly want to maintain it, right? So they don't really see side effects from this, from what I was getting from this doctor. like they stated, it's not really going to make you worse. The question is it going to work? How well is it going to work? How long can you get into remission? I also asked, so this is a personal question, but I've not been able to have children due to my disease. Pregnancy will make me extremely sick, and I will start hemorrhaging and bleeding out and lose the pregnancy. Besides that fact, I get severe hyperemesis. All kinds of things happen to me. So it's almost like my body completely rejects the fetus. Completely. It's like I'm allergic to pregnancy. It's insane. So when I explained to her more in depth, which I'm not going to do on here, but I explained to her more in depth what happens to me, she agreed, yeah, it sounds like my immune system's obviously rejecting the pregnancy. And, in theory, if this did work for me, then that it might be a possibility that I could have children on my own if I'm in a long-term remission and the stem cells work. However, that depends on if they work, how well they work, and how long I can stay in remission. So in theory, if you're a woman in that position and your autoimmune disease has been keeping you from being able to have a family, then this could in theory, could help you to do that if it works for you and if it works well for you. But I think even with that, you're taking a gamble, because just from my own medical knowledge, which obviously I'm not a nurse or a doctor, I'm just another patient. I was a CNA for years, but that's very different from being a nurse or a doctor, okay? But just from my own medical knowledge, if you are in a long-term remission and your body always wants to go in a flare and your immune system wants to rage during pregnancy, my thought would be that it could trigger a bad flare regardless of having this stem cell treatment. That's just where my mind goes with it. So I'm not saying that's a fact. I don't know. I certainly don't know that for sure. That's just my concern when I think about that. So I think it's still a gamble. If your body reacts really negatively to pregnancy with autoimmune disease, I think it would still be a gamble. So something I would really strongly think a lot about, and that's all I have to say about that. I want to move on to the treatment plan at this point in the video, just to tell you guys what they want to do. And it's a lot. This is pretty crazy. So they do a preliminary examination. They take blood and urine tests. You get a consultation with the doctor. Obviously, they're going to take your vitals. They do an ECG. Then they want to do an infusion with umbilical cord-derived multipotent stromal stem cells, placenta-derived multipotent mesenchymal stromal cells, and exomes of mesenchymal stem cells. They also want to do platelet-rich plasma and placenta-derived multipotent mesenchymal stromal stem cells as in a form of injection into my scalp to deal with the hair loss, the autoimmune hair loss that I'm dealing with. They want to do plasmapheresis. Look that up. The reason for this is to remove autoantibodies from blood circulation. This does make a lot of sense to me, to be honest. It's also super inductive system physiotherapy. They send you home with nasal sprays. So a set of 5 bottles is given to patient to go home with for maintenance therapy for 5 weeks. And these are secretome of mesenchymal stem cells and exomes of mesenchymal stem cells. And then this other type of physiotherapy. So they want to do the stem cell infusion. the injections into my scalp with stem cells and PRP, the SIS physiotherapy, plasmapheresis, this other type of physiotherapy, also IMR therapy, intracellular metabolism recovery therapy, a set of antioxidants, amino acids, vitamins, and microelements. It's an IV. It's apparently looks like 7 IVs, so maybe over the course of a week. Increases and prolongs the effects of stem cells up to 2 to 3 times, restores the general metabolism, compensates for deficiency of metabolic substrates and coenzyme. So this treatment plan is, I think it's 9 days long, but you're there for 11 days. This is about $32,000 for this. I'm not gonna lie. It also includes this, so you stay at the clinic, you're monitored 24/7 by medical professionals, you get a translator, English-speaking doctors, your stay includes you and a companion for the duration of the time. They pick you up at the airport, they drop you back off at the airport. You don't have to be trying to navigate in another country that you don't speak their language, and you get to bring a companion, and you get 3 meals a day, and that's all covered. From what I've seen on their website, it's a pretty comfortable suite that you get in the clinic for you and your companion, and it sounds like a lot of money, but to be perfectly honest with you, I think that you are getting a lot for the money. And if you had to do this in the United States, it would cost a lot more. So, they're doing this for MS, autism, dementia, all kinds of different diseases. They treat with this, and I'm going to do whatever I can to get the money up to have this done, and let you guys know how I'm doing on my journey. On my journey, A, to raise this money, B, once I get there and have it done, I'm going to vlog as much as possible. And also how you guys can raise money to get this done. If I figure out ways to successfully do that, then yeah, I'd love to help other people maybe have some hope, because this is really difficult, these autoimmune diseases, and dealing with them and the symptoms, and trying to navigate living your life and having a family and working a job, and even a lot of my friendships, like I try to make new friends, and a lot of times I have to cancel plans, and people eventually just give up because I'm not feeling well. I really want to be out doing certain things and meeting people, but a lot of the times it's just like I can't really commit to things because I never know what fuckery my body's going to pull on me next, and it's very unpredictable. So I hope that this does give some of you some hope. It definitely does for me. It's expensive right now. And if I go there and this works, and I'm able to raise the money to have this done, then I really want to start to advocate for getting insurance to cover this. Because the fact that this is still experimental and it's not being covered, and there isn't a bunch of nasty side effects or cytotoxic drugs involved, if there's even a 50% chance, if even 50% of people with autoimmune diseases that respond well to this treatment can come off their anti-rejection and all these cytotoxic drugs, then it's worth it for our quality of life. So that's it, you guys. I hope you enjoyed the video, and I will keep you guys posted on how I move forward with this. And thank you for your patience with the past few weekends that I haven't been able to post because I wasn't feeling well. I uploaded a video kind of talking about that, my general update, and the current lupus flare I'm dealing with. So that's up now if you guys want to check that out. But stay strong, guys. I'll see you next weekend.